So welcome again to the people in the audience here, and welcome to all of our folks who are joining us online. It's great to have you all with us. So I had the good fortune of being with a COO in a very small specialty care arena who's in line to be CEO. And in this conversation, we had a chance to really kind of kick around and talk through what's that going to take. And it became very clear, two things. One is that the board really expects this person to come forward, their future CEO, to have a very clear vision of the future. And the second thing that became very clear is that there's no such thing as a clear vision of the future. Right? Healthcare exists in a VUCA world. And you've probably heard this acronym before. It's volatile, it's uncertain, it's complex, and it's ambiguous. You all are in luck, though, because we have a panel of experts who are going to be here today that are going to be able to give you a lot of really useful insights to chew on, as we were saying before, right? That I think are going to really help to provide some clarity as you think through the future of the healthcare workforce. So I'm Ted Witherell. I get to be the moderator today, and I'm thoroughly glad to be doing that. My background, I've spent about 30 years in healthcare before coming to the faculty at Harvard Chan, and I currently do a lot of work with physicians and with leadership within healthcare. I'd like to introduce our panel, and then we're going to jump right in and get you guys talking. So I'm going to go alphabetical, right? So when I go last but not least, it's just alphabetical. So first on my right here is Karen Donelan. Karen is the Stuart H. Altman Professor and Chair in U.S. Health Policy at Brandeis University. She also is a degree recipient from Harvard Chan and a former faculty member here as well, among many other things. So welcome, Karen.
Thank you.
Next is Kara Greer. Kara is the Chief Talent Officer at Tufts Medicine, the system, and the SVP of HR for Tufts Medical Physician Enterprise. Again, among many other things, having had many leadership roles throughout healthcare before coming there. So welcome, Kara. Good to see you as well. And alphabetically last but not least, Joanne Pokaski. And Joanne is the Assistant Vice President of Workforce Planning and Development at Beth Israel Lahey Health System. And her team does a number of different things that really inform what she'll be talking about, which is really around the workforce itself and workforce development and workforce planning. So thank you all for being here.
Pleasure.
Let me start off with a question for all of you, just to really kind of get us going. So we really have the way I view this, two audiences. We have the folks who are our current students, who are current and future leaders in public health, right? And then we also have a really vast online audience here that is, they're folks who are current practitioners and current leaders in healthcare. So could you speak to both of our audience and tell us about two trends or forces that you think are really going to be impactful on our audience over the next 5 to 10 years? And I'm going to start with Kara.
Yes, well, good afternoon. It's a pleasure to be in the studio, and also a warm welcome to everyone joining us remotely. Two trends. I would say the first trend is our call to action of why we're here, which is healthcare will remain a critical service that we need, not only here in the U.S., but across the globe. Secondly, under that trend is workforce shortages. And it's possibly to the students some of the reasons why you're exploring your degrees in public health and adjacent degrees. The healthcare workforce shortage in the U.S., it will continue, and it is continuing. And in some areas, we actually are predicting that it will worsen over the next 3 to 5 years. So the call to action around how we think about workforce, inviting people into the profession, and really tackling that basic supply and demand. So the supply issues that we have of the workforce are outpacing the demands. And that's underpinned by the aging of our workforce, the aging of our population, and then thirdly, a decrease in some areas of folks going into the healthcare field. And you'll hear more about that from some of my colleagues. So that's trend one that I would say kind of kicks us off. Yeah. Might be why Ted had me go first, but that's kind of trend one of what kicks us off.
Just a couple of small nuggets in there, right?
Yeah, the second trend, I would say, which many of you as students and those of you who are working in the industry are experiencing, which is a shift in models of care. And specifically the outpatient care setting. And so you're starting to see a focus there. Ambulatory, standalone centers, urgent care, retail, And then an overall kind of call to action around wellness and early intervention, which really starts to talk about access and the need for primary care for our populations. And that trend, again, is having a need to think about what type of workforce will you need to fuel an outpatient care setting. And you'll hear more from my colleagues about the impact to pipelines, competencies, and then again, ensuring we have interest of folks wanting to go into those careers. So I would say those are two trends I'd kick us off with.
Great. Really great way to start us off. Thanks, Kara. In particular, another one of the threads that we'll get back to is the notion of access, right? So we kind of speak about that too. So thank you very much. Great. Let me turn it over to Karen next.
Hi, everybody. It's really great to be back here in this building where I spent 12 wonderful years. The place that I, as a workforce researcher, am spending most of my time right now is in thinking about how we are going to cope with an aging population in a time when probably the two types of physician and nurse, advanced nurse and PA labor that we need is not adequate in its geriatric skill and its primary care skill, right? And so how do we care for sicker, older people who need a lot more support and have a lot more problems and coordinate their care effectively? So aging population is one. The other is that we've actually produced a lot of nursing labor over the last couple of decades. It has far outpaced the production of physician labor. Great career, great pipeline there, but the distribution of that labor is not even, just as the distribution of physician labor is not even. So I'm thinking particularly about rural communities. I'm thinking particularly about urban kind of primary care and care delivery deserts. As we think about the impact of public policy, the impact on Medicaid budget, there are places in our country that are really reliant on public policy support, both to build the pipeline and to support the facilities. And we are just seeing a lot of facility reductions already. And the facilities in those areas for those older folks that I talked about earlier have been particularly hit hard by the pandemic and the post-pandemic period. So that's just going to shift everything to families and to communities. So we have a big issue to confront, and that's where I spend a lot of my energy now.
You'd also mentioned that you have a couple of daughters who are nurses as well, so you have a particular investment in the nursing population.
Yeah, I'm married to a physician, and I have a nurse practitioner and an RN. So we spend a lot of our family dinners thinking about these issues.
Thanks, Karen. Joanne.
So my two themes are uncertainty, is the first one. Studies are estimating that between 250 and 350,000 people in Massachusetts alone may lose health insurance because of recent federal policy decisions. So the impact of that is huge. And a secondary impact, it means some uncertainty for healthcare entities, thinking about, well, where's our money going to come from, right? And then you think about research, and whole sections of research have lost their funding under this administration, and funding uncertainty in research is a really big deal right now. So with all that uncertainty, we've gone from a post-COVID, fill all the jobs, let's get all the jobs filled, to really a new charge, which is, do we really need this job? Is this job really one that's going to be stable in the long run? So a real shift in this moment right now with the federal uncertainty. And then another thing I want to talk about is immigration. So I'm also the chair of the State Workforce Board, and I say loud and proud that this economy in Massachusetts relies on immigrants to grow. And the healthcare industry relies on immigrants. We've seen a lot of immigrants come to this country and take jobs in healthcare. A lot of them are frontline jobs, and we count on immigrants as part of our workforce. That's true in hospitals. It's also even more true in skilled nursing facilities and other sites. So all of us are good at documenting and making sure that people who are working for us are documented to work. But policy changes may make a lot of those people suddenly ineligible to work, which means we run the risk of losing a good chunk of the healthcare workforce in the very near future. And so I think about that a lot.
Nice. It's another, your point kind of underscores another one of the themes we're hearing all the way through here. It's this inadequate workforce, right? We don't have enough workforce to meet the demand, and this is another example of that. That's great. Thanks, Joanne.
It's like a tidal wave
Yeah.
you can see in the distance.
There's got to be a nicer metaphor than that. Thank you. No, thank you all. It's a great start. I feel really good about where we're going. What I want to do now is dig down and get underneath this a little bit. Before we do that, though, a couple things for our audience that's online. You probably have been noticing we've been dropping in some statistics as we go through this to kind of underscore some of what we're talking about. And please feel free to put your thoughts and notions in the chat as we go. We have a wonderful group of folks in the back, all mic'd up with headphones and things like that are watching. So as you come up with themes and threads, they'll be feeding it up to me so I can bring that into the conversation as well. To get started with that, I'd like to ask you to do a poll, again, for the online folks. So for the poll, there's a question that should be popping up for you. And the question is, which of the following most concern you? All right, and the choices are burnout, shortages of caregivers, as we just spoke about, reimbursement of workers, disruptive technologies, or other, anything else. So while our in-person audience doesn't have a chance to take that poll, think about that just a minute. We're going to come back and hear the results, and we'll take it all from there in just a moment. So drilling underneath this now, I want to know how our workforce is doing. And so I'm going to ask the question to Kara. So one of the threads that came through so loud and clear from all of the folks who registered, and thank you, by the way, when you registered, you gave us great notions and thoughts and ideas for topics to tackle, which is how we structured this. One of the threads that came up was how hard it is to balance the demands and needs of the business side of healthcare with the clinical side of healthcare. And it's for many folks just almost an emotional issue, right, that really has come forward. So between that and then the notion of burnout and wellness, et cetera, maybe you could speak to those for us.
I would be happy to, Ted. And we've laid out a lot of what sounds like problems. So you're in the right, you're in the right place, because I view the challenges that we have actually as opportunities. They're opportunities to solve problems, to innovate, to think differently, and to really use some of the skills on the student side that you're studying about eliminating waste, being curious, and asking questions. And so, that's what healthcare needs. It's what it needed yesterday. It's what it's going to continue to need in the future. And for those of us who are practicing in healthcare, back to the business of healthcare, it is an industry like all industries, but I would say we might edge out as one of those that are facing some of the hardest and strongest headwinds, because the economics of healthcare is complex. And for the students here and for those of us who are delivering it, it's a complex economic model, unlike other businesses. And when you think about what's driving those headwinds on the business side, and for those of us who are delivering care, inflation. Everyone's impacted by inflation. Everyone in this room, everyone dialing in. Healthcare is impacted on the supply side, on the drug side, and on labor, on wages. And so those are real things that we have to monitor on the business of healthcare. Taking care of our workforce so they can live in the world at which we all engage in each and every day. I'd say secondly is reimbursement. Ted spoke a bit about that. The reimbursement aspect of healthcare, and maybe Karen will touch on this, it's complicated. And healthcare systems today are facing struggles both on the government payer side and on the commercial side. And you read about some of that in the paper today. And then finally, why we're here today, it is workforce. It is sort of the other headwind. And so that's the business side of what levers we look at daily, monthly, quarterly on the complexity of what it means to be in healthcare. What's the impact of that, working in that industry? We hear a lot about wellness. We hear burnout happening. There's always been a concern about burnout in healthcare. The pandemic accelerated that. The pandemic made that more transparent to the public. One of the things I hear from those that I support in my job is how to decrease administrative burden, the waste and the friction that our providers have to go through in order to see you, to see your family members. And that's one thing that we focus on and that we're trying to do. And that can include things like helping our physicians take notes through automated scribes, helping our physicians code better, using some of our new technologies to prioritize work and prioritize patient needs. One of the main things when we talk about burnout with our providers, it's can you help decrease some of this administrative burden? And that rings true, I would say, and it is an important component for us. The other piece certainly of wellness, and I think all of us here in the panel, and for those of you in other industry as well, being able to ensure that there's resiliency, that there are programs and services that help your staff recharge and re-engage. I'm proud to say the workforce that I'm at, we take that as a key people strategy. And we're seeing the feedback of that, again, helping us have a healthy climate, helps us provide the best quality care. And while it's difficult and you hear the pressures, I also want folks to know we've got some amazing people delivering care at the front line. And if we can start to reduce some of this administrative burden, that has a significant impact on the ability to provide care and to work at the top of people's licenses. And I'd say the one thing, who knows here in the audience or remote, maybe you can put it in chat, I don't know what parameters you have, but we say sometimes for coding, we want to reduce pajama time, which means some of our providers have to do their coding and documentation after hours because they're so busy during the day. Those same people want to go home to their families, right? Go recharge. And so we're working hard to allow, through different modalities that I just addressed, to reduce that and to increase wellness, right? And what our providers today want back in their work structure.
Right.
So I'll end there, and I know my colleagues have other thoughts as well.
Well, a couple of thoughts that I would, we're going to queue up, you're queuing up potentially technological solutions, so we'll go there in just a moment. But one of the things I'm heartened to hear you talk about is when we think about the burnout / resilience challenge, oftentimes what I've seen is things to help the individual. We'll give you a class, meditation, etc. What I really like about what you're talking about is you're getting at the systemic stuff around administrative burden. There was an article in Becker's today that talked about, and it just talked with 10 different people and what they're doing, and it seemed like that was one of the threads that went all the way through it, was trying to reduce the friction, as you just said. So thank you for that. That's
Certainly.
great. Let me go back to the poll for 1 second. And then, actually, it sounds like you're going to jump in there, Ken. Why don't you go ahead and jump in? Yeah.
The one thing I would say, we didn't talk about the growth in the administrative and managerial workforce in healthcare, but over the last 2 decades, those administrators and managers have grown 8 times faster than the rate of physicians per capita in this country. And you've seen, actually coming here out of school and a few other studies, sort of thinking about what that new workforce of administrative managers is doing. Some of it is tech, some of it is population data, some of it is EHR, capacity work. But when physicians and other clinicians tell you that they are feeling the pressure of administration, they are quite literally, in most of our organizations, feeling the pressure of administration. And so it is it's something that we don't tackle in health as much maybe as we should, but I think it's all part of this distribution of workers that has been a little out of balance over the last couple of decades.
And a number of clinicians who I speak with underscore that, from that existential feeling of like they keep increasing and we don't, kind of a feeling that comes out sometimes. Yeah, that's great. Thanks, Karen. So to go back to you all on your results of your poll, the numbers keep shifting, so you're still voting. Polls are closed now, people. So here's the way it came out. Burnout was 41%, and that increased the more Kara talked. Workplace shortage is 44%. That's the top vote getter. And then reimbursement is 11%. When we talk about that, I expect that'll go up in a minute. And then disruptive tech was 5%. So they're all clearly real, for y'all. But the two biggest ones from what you said seem to be around the shortage and the burnout piece. And I would say I want to make a connection back to that notion of reimbursement. Our panelists were speaking just a moment ago about reimbursement. Now, it's not showing up on the poll here, but really at the end of the day, the changing models of reimbursement, the ability to be reimbursed, all those kinds of things really are underpinnings that are really cutting underneath a lot of the other things that are getting higher scores for you. So thank you for participating in the poll. Let's turn now to, I want to kind of continue. I said, how's the workforce doing? And I want to talk a little bit about workforce skills. So if I could turn to Joanne for this question. So when you think about the experience of the workforce of the future, what are the skills that are really going to be most in demand and most needed? And maybe if you're up to it too, a little bit about some of the jobs and some of the roles that might be big as well.
Sure. I'm going to start with the basics, which I always start with in healthcare, which is being able to be in person is a really big deal in healthcare. And as we look at how industries in Massachusetts rebounded after COVID, there were 3 industries that rebounded the slowest: education, healthcare, and utilities. And what they have in common is they both have a lot of in-person needs. They all have a lot of in-person needs. You need to physically be there to do the job. And that's gotten harder in a time where people could work from home, potentially, right? But we still need to fill these in-person jobs. On the flip side, as the economy gets less certain and people worry about AI taking their jobs, I think healthcare is a little more secure, that you're still going to have to be in person, but that's a good thing. And maybe that's a little bit of a buffer from the impacts of AI at the end of the day, right? So I think the ability to be in person is still a really important competitive edge for every job seeker out there. And I think it's still a challenge, particularly for frontline workers, allied health workers, to physically get where they're supposed to be, to take care of their kids, to take transportation that gets them to a hospital that often is, or a healthcare center that's often not connected to public transportation. So that in-person bit is kind of step one, and always something to keep in mind. Healthcare, as we all know, is very credential driven. And that's another piece that's going to continue, right? So we need nurses to have credentials, rad techs to have credentials, surgical technologists, medical techs, respiratory techs. I spent a lot of time in this allied health space thinking about all the jobs that need maybe an associate degree. But, people don't grow up saying, oh, I want to be a surge tech when I grow up, right? Or I want to be a rad tech when I grow up. They want to be a doctor or a nurse. And it's often people a little bit later in life say, oh, this would be a great career for me and I can make a lot of money. But then right now we're saying, well, it's a 2-year degree. So how do we help people who maybe have families take that time to get that 2-year degree that we desperately need them to get to be part of the workforce? So I'm spending my time thinking a lot about that and working with community colleges. So in Massachusetts, community college is now free, which is a huge step, but your time is still really important, right? Because that's 2 years, maybe you're not earning a paycheck while you're doing this studying. So we're thinking about how do we access free community college, but also support people in getting the time they need to do a lot of hands-on training to jump into critical roles that we desperately need filled. And we're still using travelers and still trying to scrape by, and we need more people in these key allied health roles. So credentials continue to be an issue. Another upside, though, is shorter term credentials, like to be a nursing assistant or a medical assistant. 10 years ago, if you wanted to be a medical assistant, maybe you would spend $4,000 on a program or go somewhere, go to a community college. Now you can find a hospital or another institution that's willing to pay you while you go to school to train to that role. So that has really changed, and it really offers some great opportunities for people who want to go down that medical assistant or nursing assistant path. And then the third thing I'll mention in terms of skills and demand is, with all the uncertainty, we need leaders who really are good at managing change and helping lead teams through change, good at communicating, good at being able to pivot, good at helping a whole team pivot. And we need employees who are able to say, okay, this is the situation I'm in and I need to kind of go with the flow, and if I can understand what's happening, how can I pivot as well? And I think that ability to surf change is going to be really important now and in the future.
It's huge. So many good points you put in there. One, there used to be a commercial out there talked about how, when I showed a bunch of kids, when I grow up, I want to claw my way to middle management, right? It's not what we want, right? But no, so many good points in there. I think that the other notion I'm seeing a lot of, and this goes back to the reimbursement piece, right? We have a lot of advanced practitioners moving into the space that only maybe physicians were in before, right? That's another shift and another change as well. So I'm going to queue up a question on leadership. And this is not one that we prepared for in advance, so I'm going to give you a minute to think about this. But I want to ask just in general about leadership, because you put it out there, Joanne, so I'll kind of post it to the three of you. When you think about leadership, how should we be thinking about leadership? What advice do you have for healthcare leaders? And let me start with Kara.
Yeah, absolutely. It's a great question, and there's no more needed time for leadership than now in healthcare. And the depth and breadth of leadership, it is a endurance sport in healthcare. And many folks think about leadership, they think about one or two styles that they use to lead. Healthcare requires us to use all of our leadership characters and styles, from being able to set vision, which we just heard about, the need to understand why we're going somewhere, to the need to create collaborative spaces for the best generation of ideas, to the need to have pace. Things in healthcare need to get done. And execution and delivering results is part of leadership as well, and the accountability to that. I think the other piece, and we don't necessarily teach this, especially on the physician side. And so I wanted to make a comment earlier. Leadership is also, you sometimes hear a triad model. And so that means we lead with our physician leader, our nurse leader, and our business leader. And that's how organizations have the very best of all three of those different domains of the workforce. And so team leadership is really part of healthcare leadership, and I think the leadership skill to create healthy climate, which again is why people come to work. Do we want to come to work not only for the leader that we work for, but Press Ganey is actually showing now folks are also considering who those executives are that they work for, and the importance of their vision and their connection to the front line. So it's a passionate topic that I hold near and dear, but it is one that you're seeing more and more as a core competency, that not only we say it's a core competency, but there's education and training that has to go hand in hand to help our leaders navigate in today's world.
Yes, very well put. And I would also add that there's a specific set of reasons why oftentimes having the clinician be in those roles in healthcare, like having clinical leaders with clinical credentials, becomes really important. There's a whole dissertation kind of just on that alone, and yet clinical training does not cover leadership, right? So at the end, I'll talk about a couple of different programs that we have that are kind of targeted towards that, because actually in some of the questions that came through, we're asking about exactly that. So excellent, thank you.
So,
Karen.
So I'm going to go in a different direction with this, which is these are healthcare organizations whose primary focus should be on the well-being of patients and people who need help, people who are coming in the door, people who are not coming in the door but who might need to access those services. And the best leaders in healthcare that I've worked with have a compelling value set and vision for how they're going to interact with that community. People get educated in all kinds of silos and all kinds of organizations. Most of our patients don't come from, our peers at medical school. They come from folks who live every day, work outside of healthcare, and need help. And if the focus is not on delivering the best care and the most compassionate care to those people, then I think any healthcare leader, can get very caught up in a whole other set of competing demands that takes them away from that primary focus on the patient. So that's always where I put my emphasis.
That's great.
And
That's
I'll
great.
just comment on that. I would say, so leadership, polarity management. So you in leadership in healthcare, you have to be able to do both, right? It's patient-centered, it's the purpose of why, and then it's managing all those domains of what have to be true within the business workforce community. So again, hence I think the complexity there, but really wonderful, wonderful points.
The ability to hold two
Hold
poles at
two,
the same
that's
time.
right,
Yeah,
that's
yeah.
right.
Jan, were you going to add anything?
Yeah, I was going to flip to the other side where just talking about some of the best leadership I've seen in healthcare is sort of bringing people together on a regular basis, being pretty transparent as to what, are we doing well, are we not doing well, and why? And how are we thinking about it? How are we collectively thinking about solutions? So that communication and transparency, I think, is so important. And then another piece is, and this really resonates for me, is everybody part of the team? We're not all working with patients, but how do we connect to that patient experience at the end of the day, and how does everybody understand how what they do on a day-to-day basis can really impact excellent patient care at the end of the day?
I remember early on in the pandemic, I was part of a team that opened up Project Hope, which was a field hospital in Boston that got opened in about a week and a half. It was amazing to me how quickly we operated to do that, when it usually takes about 2.5 years to order a pair of gloves. But one of the things that was fascinating to me was at that point, the question about who had to come in, who got to come in, and really the chasm in the workforce at that point of whether you're included or not. The leaders who did really well bridged that chasm that you're just talking about. So, thank you. Thank you all. So I want to get to a couple of other topics. One of them is around technology. And so just this idea of disruptive technology, the role of technology, even some of what we've already talked about says, well, maybe technology might be part of the solution to the problem, for example, around the administrative burden. So I'm going to ask Karen, would you mind speaking just for a moment about technology, disruptive technology, and a little bit about AI? A lot of people want to hear about AI, but that's the next one. The next Pressure Point session on October 23rd at 1 o'clock is AI.
Happy to be part of your pitch. I've had the experience over the last few decades really to see first the emergence of information technology in a really major way, right? The whole rollout of electronic health records, the access for patients to their own data through open access and a number of other great programs. And then the rollout of telehealth, both initially as a physician-to-physician consultation model, but eventually, as you saw, just explode in the pandemic. And one of the things we know from our research in telehealth is that if there's a pre-existing relationship between any kind of provider and a patient, telehealth goes a lot better. If it's the first time two strangers meet, goes not necessarily as well, but can be worked out over a period of a relationship. These are transformative technologies for those folks that I told you about earlier who live in more remote areas, who really can't, get to appointments, people with disabilities who really need support. On the other hand, the problem is that the people that I told you about also, the aging populations, people without insurance, a lot of those folks still do not, there's parts of Chelsea, Massachusetts where people do not have wireless access, right? Who do not have broadband even. You can be very, very close to urban centers and not do that. Your phones, for a lot of people have phones, and that's improved a little bit, but that comes at a cost to some of the people we serve. And then persistently, a lot of older folks, especially those with cognitive challenges, really need a buddy to help them navigate telehealth technology. So I see great promise there. We don't really teach in nursing school and medical school how to diagnose people on telehealth, by the way. Everybody's had to try to adapt, but it's not really part of a lot of curriculum yet. On the AI front, I think I see, again, can it take our notes for us? Can it do our homework for us in the setting I am in? And it's pretty good at summarizing literature. It is not good at distinguishing good articles from not so good articles, right? And it's still within the context of the health record. I find all kinds of errors. So we have to get the quality of it better. I think we have to define better what we mean by AI. It is not going to lay its hands on any patient, to Joanne's point, but it may make information more accessible if we can get those quality filters on there and evidence filters on there. So very exciting, allows some people to work from home, allows some people to not have to drive into Boston to get care. We saw tremendous benefits that way. But a ways to come for those things that really do require eyes on the patient, hands on the patient, seeing the patient.
One thing I would just add from a conversation I was recently having, that idea of the fear, right? People fearing AI and it taking away jobs. My favorite quote that a leader recently said to me was, AI is not going to take away jobs. People with AI skills will take away your job, right? Thank you. Yeah, thank you for that. And just the notion of technology and it's just this sort of role in some of these challenges that we face, as well as the idea of there's a whole segment of healthcare adjacency, right, where a lot of folks I know from Chan are actually kind of moving to look at too, especially in the innovation space. So thank you for that. All right, so we are getting down to the wire here. Just a few more minutes left here. So I'd like to pose the last question to each of you. And the last question is kind of the anything else question, but it's what one piece of advice would you like to leave our audience with in regard to the topic? And we can go whatever order you'd like. Whoever would like to go first.
I'm happy to start.
Great.
I remember being in college and having a professor say to me, "If you don't want to practice law, do not go to law school." And I'm part of the bandwagon that's been saying, "Hey, healthcare is 11% of jobs nationally, about 1 in 5 jobs in Boston. Everybody should be going into healthcare." But if you are not really passionate and if you don't connect with that purpose, maybe healthcare is not the right place for you, because I think through all the uncertainty, you're really going to need that purpose to kind of hold you steady and keep you going. So I think that purpose is a wonderful blessing of all the healthcare jobs. And if you're not feeling that purpose, you may want to rethink, is healthcare for you? And we saw in COVID some people who were like, "Oh, I have to deal with sick people now," and yeah, that's the job. That's the job of healthcare. And then I would just say, and with your purpose, find an organization where you feel part of the team.
Thanks, Joanne.
That's beautiful. Wonderfully said. Before I get to my advice, I'll just share, for those of you who do believe healthcare is your career path, it is such a rewarding profession that we've been in for decades, and it is one that you wake up with clarity, even with the noise of your why. It is about the patients. It is about helping the care teams. It's about helping your colleagues. And really, for those of you, for students who are here and on that journey, it is such a rewarding, yes, pressure-filled, but as Billie Jean King, the great tennis player, said, pressure is a privilege, and those of us who work in healthcare are humbled by the opportunity to do that. My advice would be embrace a growth mindset. I think that resonates for students. I think it resonates for those of us practicing. That having a growth mindset is really, in my advice column, is what makes life interesting, but it also makes you a really productive colleague and student as well.
That's great. Thanks, Kara.
Certainly.
Karen.
So the professor's going to say, this is a field where you can learn every single day. Whatever role you play in healthcare, the explosion of new information, the science, and the people in my family sit around literally the dinner table, so excited about new advances, new drugs, new therapies. My husband's an oncologist. What has happened in his career span is phenomenal. But you have to be ready to keep reading and keep learning and keep studying. AI is not going to solve that for you. If you are a person hungry for information, this is a great field for you. You don't have to be a doctor or a nurse. There are so many other jobs. And I would say the final thing is that if you are somebody who struggles with uncertainty and flexibility, this may not be the best spot for you. There may be places for you within the workforce, but the front lines of healthcare, the biggest predictor in some of our studies of clinician well-being are that ability, whether you can tolerate uncertainty or not, and whether you can find moments of gratitude in every day. Those are what help you tolerate all of the horrors that may await you in some of these aspects of medicine and nursing. But literally, you know, my colleague Carrie Palomara McGrath, you know, the work I've done with her really just shows that you have to be ready to change. You have to be ready to find moments where you're grateful, no matter how difficult life can be. And so bring optimism, bring joy, and try to bring that to other people who need it. And then it's a great job for you.
I love that. I love that. On my refrigerator at home, we have a quote, my wife's favorite quote, we don't remember days, we remember moments. So those moments. As I now wrap this up, let me just spend 1 minute kind of wrapping up the themes I think we heard, and then just a couple of announcements, and then we'll say goodbye to our online audience. And for our studio audience, you can stay around for a few more minutes, and we'd love to have a little bit of question and answer. So be thinking of some really good questions to stump them. So what I've heard us talk about is a number of different forces, from the workplace shortage that we're going to be facing as our population ages, to changes in reimbursement, to you name it. We had a bunch of different forces that are sort of going on in this VUCA environment right now that are creating an environment where it's tricky, it's challenging. It's there are a lot of caregivers and other folks who are wrestling with burnout, et cetera. And there's a lot of patient care friction, right? And what I'm seeing, and I heard a little bit today, is a couple of forces that are kind of showing up that may be able to help. Technology is one, leadership is another, and I teach leadership, so I have to make a call for that. But I think that everybody is here can lead from where you are, and we need that in our healthcare workforce going forward. So just a couple of announcements and some thank yous as we wrap up here. So I've done my shameless plugs a little bit throughout, but so I want to talk a little bit about some logistical stuff. A recording of this will be available on the Harvard Chan YouTube site. The next Pressure Points, as I said, the next Pressure Points installment is going to be on AI, and it will be on October 23rd at 1 o'clock, same place, right here. And then, there are a whole bunch of amazing programs that the Executive and Continuing Ed group does. And I want to just sort of plug a couple of them. One of them is Leadership Development for Physicians in Academic Medicine. Right? That is for, as it says, physician leaders in this complex environment. There's one that's going on in a few weeks in October and one in the springtime. Another program on leadership that's broader, not just for physicians, but it's broader, is Healthcare Leadership Intensive for Managers, and that's being offered next May. And then Conflict, Feedback, and Negotiation in Healthcare is another one, and I'm the program manager for that one, and I teach in that one, as well as the first one, the Leadership Development one. That one is in February, February 24th to 26th. So there's those and a whole bunch more. So that said, a million thank yous. I want to thank you so much to my panelists, my esteemed and wonderful panelists. Thank you for sharing your wisdom with us. Thank you to the studio and to the folks in the Executive and Continuing Ed for all of the work that you did to make this happen. Personally, for me, the work behind the scenes that you all did to make this happen made my life very easy. So I'm very grateful. And thank you to our audience, especially to all of you who took all the time to give us all kinds of different ideas about things to talk about. So with that, we will say goodbye to our online audience. Thank you to all of you. And I'll take the cue in 1 minute about when we were off the air. All right.